Welcome, Joyce Johnson. I'm sorry that I have to have you coming on talking about matters of dire concern, but I think it's terribly essential we do so.
Thank you for having me.
Well, you've had 40 years of clinical practice, and you've also been to many, many senior high-rise buildings and so forth, teaching dental hygiene. You've taught at the University of Minnesota dental school. You've done all sorts of things so that you have a broad range of interests. And when you say that periodontal disease is going to hit 50% of us, you're sincere and you know the subject, right?
Yes.
Yeah. Well, why are we going to, seniors, going to get all that periodontal disease? What's wrong with us?
Well, there's nothing necessarily wrong with us, and we certainly don't lose our teeth because we get old. We lose our teeth because of disease, and periodontal disease and root caries are a couple of the common things that happen to seniors. And periodontal disease, the good news about that is it's very preventable. With good care.
That is good news.
Very good news. With good care in dentistry, with care from periodontists, dental hygienists, and then with good home care, one can definitely avert that and maintain oneself. And we're going to live longer. We're going to need our teeth longer. So it becomes more important than ever that we maintain them well.
I said at the beginning that we don't do it right. We don't brush our teeth right. And so that's the subject is what? Being clean, in other words, having a pleasant, fresh taste in the mouth, versus being healthy. What does that mean?
Okay. Well, there's such a big difference in being clean and being healthy. There's an array of material if you go to the stores that you'll find to take care of your teeth. Everything up to $100 for electronic things to a simple toothpick. But many, many things get you clean. We can take a shower, be clean, but that doesn't mean we don't have a cancer growing inside of us. You can have very clean teeth, look nice, feel clean, but underneath the gum tissue there can be a lot of disease occurring. And so it's very important. I think as we grew up, we spent most of our time brushing our teeth. Now it's more important to focus on the gum. Yeah,
that's just
scrubbing around, cleaning the teeth. Now we need to be focusing on the gum tissue, and more importantly, underneath the gum tissue. There's what's called a free gum margin, and we need to be in the margins in the gum tissue.
Well, you have a variety of demonstration materials here, and this is going to be important to seniors, right? Because I suspect that I never knew I was doing it wrong for years, and I suspect that many seniors still don't realize that their type of brushing will lead to periodontal disease. So let's hear what you see what you have to show here.
And I can't make you an expert in one session, but I can certainly show you a good start, a very good start for something you can do just at home. We spent, like I said, most of our time brushing the crowns of our teeth, but where we want to be brushing is the space between the tooth and the tissue. And in every adult mouth you have a crown, which you could consider your castle, and around the castle is a moat. And it's in the moat that all the bacteria live, or the majority of the bacteria live, that cause gum disease. So instead of spending a lot of time up in the crowns, you want to spend more time in the gum tissue, less time on the crowns. So that's the area where one needs to brush.
Well, now you told me that there's a brushing technique which I've started. What was the brushing technique that kids were told not to do?
They were told not to chew on their brush when they were children, or just to nibble on the brush.
And that's what you should do.
Chewing on the brush is a wonderful thing to do. It's
because it gets down to the gums, right?
Right. It's like a good scratch for an itch.
And you should do it vigorously when you...
Not necessarily vigorously. You never have to be aggressive in the mouth. You want to think of brushing as a massage rather than a scrubbing. Massage technique. The tissues love massage, just like your body would. You don't want to brutalize your body. You want to massage your body. Same with your gum tissues. They're very much like the rest of the tissue in your body. So you want to be going into the area between the tooth and the tissue, and you can literally take a thin row of bristles and work your way down into the gum. It's a nice wiggle technique. You park and you wiggle. You park and you wiggle. You park and you wiggle. Most brushing techniques in the past have been up and down, back and forth, 45
Which is worthless, right?
Well, it's helpful. You want to keep your teeth clean too. But your focus should be with more time spent at the gum line. And instead of being in motion, you want to be parked. You want to park the bristles and think of the tooth in thirds. There's sort of a back third, a middle third, and a forward third. Teeth are not flat. They have a lot of shape to them, so you want to follow the shapes of the teeth. So front third, middle third, back third. And with just a few bristles of the brush, you don't need very many because, again, you want to be going between tissue and tooth. And you can do that all the way around this lower arch. When you get inside, you can start chewing, especially on lower front teeth. You can literally chew on the tip of the brush, and you can just sense and feel the bristles going down into the gum tissue. Once you're there, when you're bitten, you can open a little and then massage. Bite down again, open, and massage. And just that little bit of technique can improve your tissue health a great deal.
And also, you were talking about the fact that we need a certain type of toothbrush.
Yes. When you and I grew up, Roland, we had very hard, sharp, stiff brushes. They
so
weren't
we
very
have any teeth at all. We so many handicaps.
It's a wonder. We
all
brushed them away. Today, almost every brush in the market would be what would be called a soft brush, and that's kind of a misnomer because soft brushes isn't what they're trying to tell you. What they're trying to tell you is that the bristles have end-rounded tops to them. And so if you look on boxes when you go to the store, you want to look in the back to find end-rounded polished nylon bristles.
End-rounded is the big name.
End-rounded. It's like a Q-tip. If you put it under a microscope, it would look just like a nicely formed Q-tip. That's going to massage your gums and cleanse them without doing damage.
How many times a year, assuming we've got, well, it varies, of course, depending on our condition, but how many times should we go to a dentist a year? How many times should we go to a periodontist a year?
Very good question. If there are, years ago there was a toothpaste commercial, and I think it said go to the dentist twice a year. That's actually where it started, was through a commercial, not through any advice from a dentist or anything at the time, but it caught on. So people started going twice a year if they had access and the means to do that. If you have periodontal disease, it's important that you discuss it with your hygienist and your dentist, and you get involved to decide what your schedule should be. But depending on your needs and how prone you are to gum disease, probably 4 times a year is a very typical schedule for someone with periodontal disease.
How can we find out that we have periodontal disease?
Good question. Of course, go to your dentist or your periodontist.
But I don't go regularly. Let's say I go maybe once a couple years, and I'm not aware of any periodontal disease. How do I know that I have one?
Okay. A quick way you could find out is just to take a toothpick at home, just a plain toothpick out of your toothpick container. And in a side story, if I could, years ago when men used to sit in cafes with their toothpicks, nobody appreciated that, but they kept their teeth. They were getting into the pockets and cleaning out what needed to be cleaned out. But you can simply take a toothpick, slide it underneath the gum tissue gently, and hold it in there for a few seconds. You can jiggle it a little bit, just gently, then pull out and wait a few seconds. And if blood comes out, that's a good sign that you may have gingivitis or the beginning of gum disease. If you have a crown tooth, slide it under a crown. That's a place that typically gets inflammation. You can slide it under there, do the same thing, hold, and maybe double dip. Go back, do a second dip, come back out, and if there's blood, that's a good sign you should be seeing your dentist and your hygienist and find out more about that.
Final question. We lose a tooth. I mean, you mentioned that we lose an average of 13 teeth out of what, 22 teeth?
32 is our full complement, 28 when the wisdom teeth are
gone. So we lose
a
lot of teeth. So we need to do either a bridge or an implant. What do you recommend?
Oh, hands down, an implant.
Implant. Implant is it.
Right.
Okay. Joyce Johnson, many, many thanks. We've been talking to Joyce Johnson, dental hygienist, and she's provided us most valuable information about our health care and our